Welcome to RIVE, Reflections in Veterinary Education. We have a topic this show, and Eric, do you want to lead us off with the topic is?
Yeah, absolutely. This, I think, is particularly important in the context of the Academy of Veterinary Educators, where we are trying to identify expert educators. So the question is, how do we define expertise? And I can't remember if Bobby or Catherine put this in, but the Sorit's paradox is where you have a vague term to describe something that doesn't have clear boundaries. And so how do we define expertise basically is the topic. In my second master's in sport pedagogy, the lab that I worked in, that was actually their focus. Like they were looking at like how do we identify expert in golf instructors was their primary like research focus, but generally how do we identify expert sports, coaches and trainers and educators and that kind of thing. So this has been a interest of mine for a long time. So yeah, that's what we'll open up with. Catherine, what are your thoughts on that?
Oh, so many thoughts.
Yeah.
So I think, yeah, it's really a slippery kind of thing because it also depends on the context to which you want to apply it, right? So K-12 expertise may be recognized differently than, say, post-secondary, and professional may be slightly different than baccalaureate. I mean, it really depends. I think there are some underlying principles of probably expertise. I don't know exactly what they are. I can tell you what I think they might be, right? Which is a basic understanding of the philosophy and theory of education and understanding where you align or don't align with specific theories, right? So if you're a behaviorist but you're forced to teach in a say a constructivist way, you're probably not going to be as successful as if you're a behaviorist who gets to teach in a behaviorist way, because you want those things to be aligned. But I also think you have to understand the whys behind that and what the pros and cons are and have some flexibility. um, I say K-12 is a little bit different, but I think that ultimately and ideally it's probably not different. It's just that government has made it different because they're really outcomes based for their excellence. So it's like, how well did your students do on this exam? How well did your students pass, et cetera, et cetera. And we talk about that a little bit in higher education, but not so much. So I don't think that ultimately good teachers are different, whether they're in K-12 or higher education, or what they need to be measured to consider to be excellent should be different. But I think that sometimes that's forced upon us. I will say, in the context of
So
ABE.
so so sorry to pause
Yeah.
on that, to maybe we can explore that a little bit. So the idea of expertise being in education, we're talking about how well your students do.
Right. So I think that there is some argument to say that if you're a really poor teacher, your students are probably going to do not as well. But I also think that it's kind of like the NAVLE for me, right? It's this idea that we have said, okay, you can go through 4 years or 3 years of professional training, whatever your curriculum length is. You can pass all of your classes, you can pass all of your rotations, but we still need some kind of bench level benchmark across the nation to determine that you're actually able to have the knowledge you need to become a veterinarian. Now, while I fundamentally disagree that that is ultimately what should determine whether or not somebody can be a veterinarian, I also recognize that there does need to be sort of that level setting, right? Because there are some ups and downs depending on the program. And so I think that's what I'm talking about. Like, I don't want excellence to be solely defined by the outcomes of students, because you can't control students. You can be a really, really good teacher and you can still have some students fail. And you can be a really, really crappy teacher and you can still have some students pass. So I don't know that outcomes are necessarily the only way that people should be measured for excellence. I do think it's a component of excellence, right? Because really good teachers are more than likely going to have higher pass rates and higher scores, but it shouldn't be the only measure of what excellence is. And so I think that's where it becomes slippery. It's like, well, how do you define quality, right? So all of these research papers out there say one of the most significant impacts you can make in student learning is to have high quality teaching. Well, that's great, but what the heck is high quality teaching? I mean, and who defines that, and what does that look like from person to person? Because quite frankly, if I'm a behaviorist and Bobby's a cognitivist and Eric is a constructivist, we could all be really high quality teachers. and have very similar outcomes. But if a cognitivist comes and observes me and assesses me, they may not assume that I'm doing high quality work because they're a cognitivist and I'm a behaviorist, and they just don't align philosophically and theoretically. So I think it's much more complicated than it sounds at the outset by saying what defines excellence. And so going back to that idea of the ABE, we're actually in the process of that right now, right? Is we're actually doing a scoping review. A bunch of us are getting together to do a scoping review to see what the literature says about what are the competencies that really a good quality or excellent expert teacher should have. And so according to the people who have done some of the work, there's not really anything in the literature that even comes close to trying to finitely sort of define that. And so we're going to try. I don't know how successful we're going to be, but we're going to try. And I think it'll be really interesting to see what comes out of it, to see what parallels there are across different, areas, and what things are just like, well, where did that come from? So I'm excited to be part of that project and looking forward to that. But that was my $4 worth. So I will pass
Awesome.
it on to somebody else
We'll come back. I'm just kind of initial impressions. Bobby, what are yours?
Yeah. All right. So two things initially came to mind when you asked. And the first one was short, which is I think of I think my favorite definition of expertise or an expert, which is somebody who's made all of the mistakes in a very, very narrow field.
I like that.
I love that one. I don't remember who to attribute that to. If that's a Mark Twain, it might be. I have no idea. Sorry, apologies to whoever I need to attribute that to. But yeah, so somebody who's made all of the mistakes in a very, very. So that's my quick definition of an expert. But the other thought that came to mind, a little tongue in cheek here, but like, who cares? Like, why is it important for us to define and identify expertise? I mean, and I'm happy to answer my own, but like, I think it is, but I think it's valid, right? To first start with like, why do we spend all this time trying to define, and why is it important to have expertise as an educator and not just expertise in the topic that I'm trying to teach? And so that's where my brain immediately went, is I don't know that everybody necessarily understands why it matters that we can identify expertise, because they're like, well, I've been teaching for 20 years and like, that makes me an expert, right? And then the other thing that as you were talking, Catherine, I thought a little bit, you mentioned excellence in teaching, which I think is distinct from expertise, right? Because I think you could have expertise in teaching and maybe not actually apply it very effectively. And I think you have plenty of people who probably are excellent teachers, but don't necessarily have the expertise to say why. Right. And maybe they are experts. I don't know. I think that where it also gets kind of messy, but the expertise and excellence, there's a lot of overlap between them, I think. But I don't know that they're necessarily quite the same thing.
I agree. Yeah.
Yeah. So so those were my initial thoughts, was like, oh, maybe we should justify why it matters. I think that's fair. And then I have a lot of thoughts on why it matters, and I know you both do too. Some recent examples that came up, but yeah, those are my initial responses.
Cool. So the things that I think about, one is there's this researcher, a pair of researchers, Cochrane and Weiss, who did a bunch of work on expertise. And their premise is that an expert needs to be able to consistently discriminate. So to be able to identify, you are good at this, you are bad at this, or you are likely to die, you are not likely to die. So their like classic example is they had a study where they gave a bunch of simulated patients to some cardiologists, asked those cardiologists to assign a probability of this person developing congestive heart failure, and then gave them the same cases, 3 months later, and asked them to do it again. So did they discriminate, i.e., this patient's likely to develop heart failure, this patient is not likely to develop heart failure? So they could tell the difference, because some people just like across the board are like, 70%, right? It's like, regardless of patient indications, 70%. And then did they do it consistently? So when they looked at that same piece of information later, did they give the same probability of developing heart failure? So that's their premise. So how does that concept land for you guys?
I need to chew on it a bit. Although I have to tell
That's
you
fair.
that just, yeah, as an aside, I had to do this like emotional intelligence testing through my current workplace for, I don't know why, but I had to. So I had to take a test, and then I had to go to a workshop, and then I had to take a test again. And I just took the second test. And I can tell you that based on that definition, I am an expert in understanding my emotional intelligence, because literally in 4 different areas, my scores were exactly the same.
Yeah.
Exactly.
My response to that is it's an intriguing question, and I like it, but it's like we're trying to take this sort of nebulous qualitative question and apply quantitative study to it. That's what it feels like to me. I would like to quantify this. And I think that's fair. It's a fair thing to ask. Like, again, we're talking about standard setting and benchmark setting. And I think, we have this inherent desire to create those boundaries so that I can discriminate and say this is an expert and this is not an expert, and I can do that consistently. But I think it's really hard to do. And again, for something like that, that is like an expert in an even narrower field than I was describing earlier, right? Like, you are an expert at, and we lost Catherine for a second, but we are an expert at discriminating patients who will or won't develop heart failure. Does that make you an expert cardiologist? Because if I
Yeah.
train somebody for 6 weeks, they could probably get really good at that one very specific thing. And it makes you
Right.
an expert in that very specific thing. Sure. But is that what I really care about when I want to find an expert cardiologist, So I think it's one facet that could be looked at to try to, again, quantify. But I don't know that it really gets to the real question, like, that we're thinking about when we ask, what is expertise?
Sorry, John was trying to FaceTime me. Anyway,
Welcome back.
He just got back to the court. Anyway, so yeah, I think as you were talking, Bobby, one of the things that struck me was, yeah, I do see sort of like this idea of trying to quantify it, but I would also say, I don't know that expertise, can be sort of distilled down to numbers, right? So, and I missed what you said, Bobby, and you may have said some version of this, but if you ask 100 cardiologists, what is the potential outcome, and which ones of these are going to actually, get congestive heart failure, and then which ones of these are going to die, or whatever the question was. That's great. And then you ask them the same thing later and they say the same thing, that's fine. But what that doesn't allow for is the growth in between that time, right? In that 3 months. So there might be people who say at one point, yes, I think that 70% of these people are going to get congestive heart failure and that 30% of them are going to die. But why? Why did you say that? That's what I want to know. And to me, that's what's going to tell me whether you're an expert or not. So if at one point you say, well, 70% and 30%, and then you come back and you say, well, after thinking about it, doing some research and seeing a lot of cases, I'm actually kind of going to be like, oh, maybe it's 60% and 30%. And this is why. The why part is going to tell me more what your expertise is. And it's going to be showing growth and an understanding of sort of maybe some of where your flawed thinking was and those kinds of things. I think that's harder to do when you're talking about teaching, though, right? Because when you're talking about teaching, even if it's a social science, right? So in education, a lot of times they don't accept that they're a social science. They still want to quantify everything. But even if you have the same 120 students with exactly the same instructor, with exactly the same slides, and exactly the same room, at exactly the same time of day, they're still going to be different, right? And so, and then if you have 120 students who are the next year's class, then they're going to be even more different, even if it's exactly the same type of day, exactly same instructor, because things change. So I think that's what makes understanding expertise so difficult when it comes to teaching. I mean, I do think that there are things you can say broadly, right? Flexibility, ability to react, content knowledge. You have to have content knowledge. Obviously, you have to have pedagogical content knowledge, but you also have to be able to apply it. And then is it, well, I can teach a class of 120 people, but one-on-one, no way. Like, I can't do that. Or vice versa. I can teach a class of 10 people, but give me a class of 120 and you're kind of screwed. You're just, everybody for themselves. I think there's just so many variables that you could throw in there. And I think that's one of the things that makes it such a struggle. But I will say, like, it may be one of those things, and this is probably totally a cop-out, but my major professor when I was going through my PhD program was this tiny little, just sort of woman who's just this powerhouse. But she would basically look at you, and nobody knows how old she is. She's probably like in her 60s or 70s. But at one point, you ask her a question, and she'd look at you like, well, I don't know the answer to that, but I can tell you. So you can ask, we could ask her like, what is expertise in teaching? Well, I don't know how to define it, but it's kind of like porn. You know it when you see it, you know? So it's like, how do you define it? But there are lots of us who could walk into a classroom and say, wow, like that is somebody that I would want to learn from. That is somebody that I would want to teach me. And that is sort of a, I guess, measure of expertise in a lot of ways, you know, somebody that's, I think about my internal medicine and teacher in vet school who was absolutely terrifying, but he taught us 1 2-hour class on clinical reasoning, and I literally learned everything I needed to know about internal medicine to become a veterinarian and pass, because I never had an internal medicine rotation in clinics because it wasn't required. And in fact, I ran into an old classmate of mine and we were talking about what would Willard do, you know, and he was the one who taught us, and that's how we got through. So to me, was he an expert? 100%. You know, terrifying, but 100% expert.
That's really interesting. And then the second concept that we talked about in our lab was that experts can diagnose and then tune the treatment to the student. So like we would watch these videos of these expert golf instructors, and the lab the PI would be like, like, see what she just did there. Like she identified that this student was having a problem with hitting the ball in this way, and diagnosed that, and then provided a successful treatment to that learner in that context. And it was really fascinating to watch and be like, oh my gosh, yeah, like I can see all that processing happening. And we watched different videos, right, and of different people, and you would see that not everyone could do that.
That's really fascinating, because that kind of does pull in the outcomes piece of it, right? Like to see that they were to provide feedback to the learner, cater it to what that learner needed, and then see a response. But it's maybe a little bit less dependent on the learner, because like 3 weeks later, maybe the learner didn't still like that, you know, maybe that's on them, they didn't practice it or whatever. But like the expert was able to again, make the diagnosis and recommend an appropriate treatment, essentially. So I do think that is a really intriguing way of kind of in that one little snippet blending those together, which is pretty cool. I like that.
So when you say appropriate treatment, do you mean appropriate for that particular student? So it might be slightly different for every student, or do you mean
or that context, right? Like you were
Gotcha.
talking about the 10-person classroom versus the 120-person classroom, right? You're facing a classroom of 10 students who are disinterested.
Yeah.
That's going to be a different diagnosis and treatment for the 120 student class that's disinterested.
Yeah. I think that's really interesting. I think sometimes one of the things that I have to tell, especially new instructors and teachers, is that you aren't always going to reach every student. And I think it's also, but I do think that that's important, right? It's a measure of expertise to understand not only how to do what you've just described, Eric, but also to recognize when you just can't get through to a student. And that means maybe you need to send them to someone else, or you need to provide a different kind of reach. Like, it doesn't mean you should give up on that. I'm not saying that. I'm just saying that maybe you're not the person that can teach them, and recognizing that is also part of expertise. I will say that you don't want to do that or acknowledge that out loud, because I've had that happen to me as a student, and it's really humiliating. So, you know, don't do that. Like I literally had a professor we were going through cardiology, and I know not so much. But I had asked a question and he tried to answer it 3 different ways, and I was clearly still confused. And then another student asked a question and he started answering her question. And this was like in a lab. He started answering her question. And I was like, I'm sorry, I don't understand how this applies to my question. And he just looked at me in front of the entire class and was like, I don't know how to answer your question. We're moving on. Like, I can't. Well, he actually said, I can't make you understand. So we're moving on. So it was my fault, right? Because I was stupid. And so I felt dumb. So that's where my caveat comes in. Don't acknowledge that. But in that situation, if he had said, you know, I'm having real difficulty figuring out how to explain this to you, let me think on it, or maybe here's somebody else who could potentially ask them that question, that to me would have been the mark of a much better teacher than somebody.
Yeah, that's really harsh, because when you said that at first, I was like, oh crap, I think I kind of do that. But like the context, not like that.
Right.
When I teach acid base, which is a concept that like a lot of students struggle with, they find very intimidating. I love it. I think it's fascinating. And but whenever I approach it, I'm like, this is how I present it. This is how I'm going to teach it. And I find that this works for a lot of people, but it does not work for everybody.
Right.
There are other ways to approach asset-based. So if we're going through this and you're like, what, this doesn't resonate with you, let me know. And I can point you to other resources or other
Right.
people that can address. So I put it on like me and I make it like
Right.
kind of anonymous. I don't,
Yeah, yeah,
I don't go,
yeah.
you look like you're confused. You should get out and go find your own resources. But, but I do think it is important to acknowledge that there are different ways of thinking about this to get to the same result. And I might not be the best person
Yeah.
to guide you through if this isn't working for you. So I do think that's bad, but I got nervous. I was like, oh my God, I might be doing something.
No,
terrible.
not, yeah. It was just the way it was said to me. It was like, it was
Yeah.
my fault.
No,
Like,
that sounded terrible.
yeah. So that to me is also a mark of expertise too, right? Is that flexibility that I talked about before, is this recognition that I just in this situation don't have the tools that I need to help the student be successful. So is there somebody else who has those tools, or can I have some time to think about it, investigate it, that kind of thing?
Yeah.
So, because I do think, I mean, I hope that most teachers want to get through to every student and truly believe that every student there can learn. Some are going to be quicker at it and maybe have a little bit more affinity for it. But if you work hard enough, you can, right? That's the whole concept of growth mindset. So
Yeah, it makes me think of I remember I was trying to teach one of my karate students how to do a hook kick, and it wasn't right. I was like, okay, it's not right. And I kept trying to correct it. I'm like, I don't know the words to say to make this better. And so I had one of my other senior students come over and work with him, and they were able to say the thing to
Yeah.
make it right. And I was
Yeah.
watching that process too, because I'm like, I want to know what to say
yeah,
the
Yeah.
next time I'm faced with this,
Yeah.
and iterate that over, almost 40 years of teaching martial arts. And now, whenever I work with one of my, kind of senior students she's been doing martial arts for 15 years and teaching it, and we'll be both looking at stuff, and I'm like, oh, I see this and this and this, and this is what you need to do. And she's just like, what? How are you seeing? I'm not seeing half of that. What are you even talking about?
Yep.
You're right, but like, I'm just not picking up on it. I'm like, yeah, I've been doing this for a long time.
Yeah. But you know
Yeah.
what? We're talking about like, you have to be a content expert and things. And I think about like when I'm in the clinic and we're talking about ECC stuff, boom, I can rattle this. I'm like, yep, I know how to explain this. And usually in lots of different ways for a lot of these concepts to get to people. Then I've been doing more surgery lately because we don't have enough surgeons, right? And so I'm in the OR and I'm trying to like help a student in this situation. And I'm like, I don't know how to describe what I'm trying to say. So here, hand me the instruments real quick. I'm going to show you what I mean and like try to fumble through it. But like, yeah, so that really impacts my expertise as an instructor because my content isn't quite there and I'm out of my element. And so, yeah, there is a big difference. And so, yeah, in certain contexts, I have all the words, like I know 9 different ways that I can explain this, but over here, I'm like, if you can't get it this way, then yeah, we need to find somebody else. Or I try different methods and I'm like, I'm sorry. But just what you said, Eric, I don't have the words to make this make sense. Like, I don't know enough to explain this better to you. Yeah.
Yeah. But I think there is also one of the cruxes, one of the issues when it comes to talking about education expertise is that a lot of people, and I use this analogy a lot, right? Like a lot of people call themselves teachers and educators, but they don't necessarily have the foundational information and knowledge. And that's not to say that you can't be a teacher without that, right? You can't be a veterinarian without that, but you can be a teacher without. I'm not saying that, but what I am saying is that there is a huge difference in talking to somebody who calls himself an educator that can speak the education language versus somebody who calls himself an educator that is doing it based on experience. And I think you need both of those things, right? So Eric, you know the language of karate and you've been doing it for 40 years. You're going to see things in a way that is very different than somebody who's been doing it for 15 years or 20 years. And it's kind of akin to sort of like I sit there and I watch The Voice sometimes, right? That reality show where people come on and they do a blind audition or whatever. And I'll be like, oh my, and I was a professional musician for a long time, but I wasn't a voice person, right? So I'm sitting there like, oh my gosh, that's such a pretty, voice and blah, 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 blah. And I probably have a little bit more musical knowledge than a lot of people do, but then nobody turns around. And I'm like, I don't understand why they didn't turn around on that one, but they turned around on that one. Well, that's because that's not my area of expertise. I haven't been like just in it and doing it every day of every hour of every day. And I think so experience is really important to be able to pick up on those really slight nuances, especially when you get to that point where you're no longer a novice. Like the growth chart, it goes like this and then it kind of just levels off and that's what it happens for everything. So yeah, your student in another, 15 years is going to be probably just as good as you are today, but not as good as you will be in another 15 years. And that's just something you have to accept. But yeah, it's a combination for me of education and understanding
Yeah.
also.
And there's more than one way to attain expertise too.
Absolutely.
I know we haven't defined it yet, but like I think again about my own trajectory, and there are a lot of things I've learned about teaching through years of trial and error, a lot of error. And then I started doing the official training, right? Like my ed psych masters, and that sped up the learning process, right? It was certainly way more efficient to actually just learn the material and the theories behind things, and oh, that's why that never worked and this one does, right?
Yeah.
So there's, and I do think it also helps to have that training, right, in the development of expertise, to be able to discriminate a little bit more on some of those things. So I think you can develop expertise over time and with experience without necessarily specific training. I think it's way harder and far less likely to be successful. But I do think, and I think that's why a lot of people experience that convergence of the two, right? You have some training and then you have some experience, and both are really important for expanding expertise. Like, I don't know that you could just go and take classes on teaching and then 10 years later, like keep reading about it, whatever, 10 years later, go and try to teach a class once and be like awesome.
No. Yeah.
Right. So it is a combination of, I think, training and experience that is what is going to be necessary for most people to attain expertise in teaching. But yeah, I don't know.
Do you think that expertise in teaching is expertise in teaching, or do you think expertise in teaching martial arts is different than expertise in teaching veterinary anatomy or veterinary medicine or engineering? Or
good question.
I think that a lot of the principles are the same. Because my degree was in sport pedagogy. We focused on psychomotor skill acquisition. It was primarily like 90% of what we did. But it was extremely easy to take almost all of that content and apply it to my veterinary classrooms. There were a few things that were a little bit different for teaching psychomotor skills as opposed to, cognitive learning, but, pretty minimal. So I from my point of view, I think that it cross reacts pretty substantially, that baseline of knowledge.
I think that that's true if you have expertise. Okay, I'm going to throw this out there. I just thought when you were talking, I'm like, oh, well, that's transfer, right? And like, right. So if you can transfer this knowledge from this context to another context, near transfer, far transfer, whatever, but like, maybe that's one of the, I'm just positing this right now. Like, I haven't really developed this. Maybe other people have talked about it, but I'm thinking like, that could be a tenet of expertise, is the ability to take this knowledge and apply it to a unique situation. I don't know.
But does that include, like, Eric, do you think that you could transfer that information to a kindergarten classroom?
That's a really good question. No, that's really important. Because the short answer is absolutely not. Like, that the stages of development of children, but I didn't learn any of that either.
Sure,
like, that was not a part of the program. If I had a class in that, I'd probably feel more comfortable with it.
Maybe.
Yeah.
But I think that's the question of like transferability too, right? So like, is it transferable to learn about educational psychology in adults, for example, versus then having to go teach children, and are they fundamentally different or not? Because I think that's where that pedagogy versus andragogy sort of argument in, because there's that sort of continuum. So I can tell you right now, if somebody threw me into a kindergarten classroom, I would probably be weeping in the corner, curled up in a ball in about 5 minutes, because I have no idea how to handle one kindergartner, much less 30 screaming children that are somebody else's. So
no way. I think both of you. So here's my take on this, and here's where I think the expertise comes in. I don't think you're instantly going to be amazing at teaching kindergartners, but I think you're going to be way better than the average person who goes into a kindergarten classroom, because you do have a lot of that knowledge and you can transfer. And transfer doesn't mean like you're instantly an expert on this new knowledge, right? But you are going to be able to take this, and teaching adults and teaching children, there's a lot of differences between them, but that's what transfer is saying, okay, I'm going to take this and I'm going to take this information and apply it, massage it, get feedback, right? Figure out what's working, what's not, make some adjustments, which is what you would both do. You would both say, okay, day 1 maybe was a little rough. Day 2 is better. Day 3 is getting better and better. And I think you would do that better and faster than somebody who wasn't an expert in education. So I don't think an expert means you can, you 100% would, Catherine, 100%. You don't think so?
No, I just feel like we should do an experiment.
Oh, okay. I was like, what is this? That you
I'm
were
like,
doing the Mr. Burns fingers
How
over
can
here.
we set this up in a way to see whether that?
But I do, because again, transfer doesn't necessarily mean that, again, you're going to get it right on the first try.
Sure,
But
yeah.
you can take that knowledge and apply it in a new context. And again, say, okay, I'm going to get that feedback and I'm going to tweak it and I'm going to make it better. And without necessarily somebody coming in and telling you, oh, here's all the information that you need to know that's unique to this exact situation, right? Like that's why an expert surgeon can come through and be like, I've not done this procedure before, but I've done all these other ones. And so I'm going to apply that knowledge to this brand new situation. I think that's an important part of expertise, because that's how new knowledge gets developed, right?
Sure.
Sometimes it's accidental, but more often than not, it's experts that are going just a little bit out of their field, or sometimes a lot out of their field, but taking that knowledge with them and figuring out how to apply it differently.
Yeah, I think that's true, but I also think there's a level of, so you said that about like a surgeon taking their skills and transferring it. And I think back to my days as a vet student when we had a tiger come through our what do you call it, exotics rotation, and it had something that needed something surgical in its abdomen, and the surgeons were basically like, oh yeah, it's just a big cat, we can do that. It was not just a big cat. They couldn't do it, and they discovered they had gotten into something that they could not salvage. And so I think there's a level of understanding also your limits and knowing what that transferability is, right? Now, if that particular team of surgeons had said, it's just a large house cat, yet it's a significantly different species, we should probably do a little bit of research on it and think about it a little bit more, then I would have been like, yeah, that to me indicates a little bit more expertise, because I think that's the self-reflection part that was missing. So
I would agree. I would say those were developing experts.
Yeah. So, and then I also wonder, like, I think about my former sister-in-law, who's still a really good friend of mine, who has taught kindergarten, first, second, and third grade, and fourth grade. And then I think about my other friend who is she teaches, like, her incredible special gift is to be able to teach high school students. And it's like 9th grade and 10th grade students who are knuck and futz, right? Mm-hmm. And she is just like a teenage whisperer. I don't know what it is about her. That's just her. That's her jam. Yeah. And I'm constantly amazed by her. She's amazing. And she teaches them science. Right. So I'm like, but I don't know if those two switched places, or if they came into my classroom, that they would be successful. They definitely wouldn't be successful right away, but would they be successful faster than somebody who doesn't? I don't know. I'm not 100% sold on that. I think you're probably right, but I'm not sure I'm 100% sold on that. I'm interested.
I love your idea of trying to figure out how to do this study.
I know, right? I'm interested to hear what Eric's thoughts are on that.
No, I the transferability, I think that I was going there as well from the direction of like the experience. Sometimes experience translates to expertise and sometimes it doesn't. Mm-hmm. And I don't know what, like, obviously there's something about like self-reflection and constant improvement and yada, yada, that gets you there. But like, you'll see these people who are like, I've been teaching this for 20 years and it's fine. And it's like, they believe that they're an expert, but it's like, okay, but like, are your students learning as well as they could? And what if we did throw you into a 10-person seminar classroom? Mm-hmm. Like, could you be, effective with these learners? So, that's kind of where I was thinking about with the transferability and experience thing. Like, I think the difference between someone who's just been doing this for 20 years and is successful, the difference between that person and what I would say is an expert is that the expert would be like, a pandemic happens and now we got to go online and we can do that in 2 weeks. Yep. Like that's an expert.
Yep. Yeah. And it's funny because you're talking about like somebody who's been doing the same things for 20 years. And I think going back to the cardiology examples. So one of my mentors during my residency is a cardiologist and a criticalist. And her husband was a kindergarten teacher or elementary school teacher. I don't know if it's kindergarten, elementary school. big teddy bear of a guy. And we would have like gatherings, you know, social gatherings, blah, 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 talking about, and he was like, I could be a cardiologist. You put me on call. I've got this sorted. I just give more Lasix. And he was like, that's it. You know, living with a cardiologist for years, he's like, this is the easiest thing in the world. And in a way, again, this that very narrow thing. You could train somebody to do this procedure over and over and over again, and they'll do it right. Are they an expert? No, they're a robot, right? Like, because I push the button every time you see this. Okay, but now something new has come in, and now this patient has, you know, VTAC. Giving
Right.
Lasix isn't going to help the VTAC, right? So that's where like somebody can be really good at doing the same thing, but you throw a wrench in that and they can't adapt, they can't transfer that to the new scenario. So that's, for me, I think, I don't know that that's the entirety of expertise, but I do think it's a key component of expertise, and a little bit what you were saying, Catherine, recognizing it when you see it, right? Like if I throw a wrench in this, and I also think about when I talk about when we see expertise and, you know, we admire people, when you admire somebody for being really good at what they do, like nobody's ever said, oh my gosh, this, like, you know, this surgeon's amazing. They can name all the origin and insertion points for all of the bones and the ligaments. Like nobody cares about that, but they say in a surgery, right? When like something unexpected happens and there's a mishap or whatever, they adapt, they remain calm, and they can troubleshoot and they can problem solve. Like that's what we inherently, I think, recognize the difference between rote memorization and reciting things and understanding things and applying things and thinking critically. So yeah, it's hard. Again, I think it's more qualitative than quantitative, but yeah, it's really fascinating.
So before we get too far towards the end, I do want to touch on one other thing, which is entry level expert versus what maybe, you know, genuine expert. So like
Yeah.
Bobby, the quote that you said, like an expert is what happens when you make every single mistake. I am still coming across cases. Like I had a case last year where this goat was doing some weird thing with its back legs. I'm like, what the hell is this? And you know, I go through it, and I, you know, the things that I did actually turned out to be the right things, but I had no idea what was wrong with the goat. Come to find out, it's like a super, super rare reaction to epidural morphine.
Oh,
And you know, when we're asked to write questions for at least the anesthesia board, I don't know if critical care is the same. We're told ask questions for an entry level specialist,
yeah.
right? So that someone who's done a residency and is boarded and everything, okay, we're going to call them a board certified specialist, and that's a certain level of expertise. That's different than someone who's been doing that specialty
Yeah.
for 20 odd years. So curious what your thoughts are.
Yeah, I was actually going to talk about that in a little bit different context. So there's a book that I had to read quite a bit of when I was in my PhD program, and it was basically how people learn, right? That's the title of the book. You can get it through the National Academies Press. And there are lots of sections on expertise and what that looks like, because obviously that's what we're trying to get people to move towards in whatever area they choose to do that. And they talk about, and I can never remember both levels, but they talk about 2 levels of expertise. And they're sort of like what you were talking about, that entry level expertise. And that is somebody who knows a lot, is able to apply a lot, and is a little bit flexible within the rules that already exist for that particular area of expertise. And then there's virtuosos, what they call virtuosos. And virtuosos are those people, they know all the rules, they know all of that information, but they push the boundaries of those rules, and they actually expand the field, and they think, oh my gosh, that's really cool. What if we did this, even though nobody's ever done it before? And so as a musician, the thing that always really stood out in my mind was the Rite of Spring, right? Which is this piece of music that literally caused trampling of people because they were listening to the Rite of Spring, Igor Stravinsky's Rite of Spring in the 1920s. And it was so dissonant to their ears and so different that they couldn't handle it, and they literally rioted and would leave like the theaters. And now 100 years later, we consider it one of the classic, you know, sort of contemporary pieces of all time, because he literally rewired our brains to hear music in a different way. That's a virtuoso, right? Somebody who takes the rules and is like, I don't really care. I'm going to do what I want, throw it all out. I know what I'm supposed to do, but that's not what I'm going to do. And so I think that's something that is also the mark of an expert, is someone who recognizes that their expertise is still limited in some ways, and that there is still room to grow. There's still room to stretch and learn and potentially change things in a way. And I don't think everybody I think very few people reach that level, right? There are not a lot of Igor Stravinsky's in the world, but there are a handful of them and across different, fields. So yeah, I agree. I think that some people, and maybe more than we anticipate, feel like once you become an expert, you're an expert, and there's not really much else to learn and grow. And I kind of disagree with that. I don't know how you all, or if you've heard that concept
No, I don't think expertise is the point,
Yeah.
right? Like, I think it's a spectrum.
Right.
And again, it's trying to quantify something. And the idea is like, we're always moving along the spectrum, not necessarily even always in the same direction. And again, with varying types of expertise, with advanced expertise, that's where you get more and more transfer. That's where you get innovation. And I 100% agree with that. Again, that's how we get new ideas, is people pushing those boundaries. But it's our desire, our human desire, to want to label things and to have quantification of all of this. That is like, at what point do you go from, and now you're an expert? Like, is that even quantifiable? I'm not sure it is, because I really do think it's a spectrum. And hopefully, like, true experts are continuing to try to grow and learn and analyze and reassess and be like, is this rule the right rule? And what if we rewrote them? And I'm breaking the rules because I believe I know better. I mean, there is almost like a degree of, I don't know if it's confidence or arrogance associated with it too. And I think there needs to be, right? Like, there needs to be a little bit of that, to be like, no, I'm not going to go with the rules. I'm going to try my own thing. But I think you have to have some of that.
So on the heels,
I think we're wrong if we think about expertise as like this line you've crossed, and now you are the thing. Yeah,
that's the Sorites sort of, I guess, paradox. But I have this other question, because I'm curious what you all think about this. Like, I am very hesitant to call myself an expert in anything, because I don't feel like I'm an expert in anything, right? Like, I do think I have some level of advanced knowledge in areas compared to other people in certain areas, right? Like, so education, for example, I do definitely have advanced knowledge and experience in education. I don't know that I would necessarily call myself an expert in education. And so I wonder, at what point, or is it ever okay to call yourself an expert? Or is that something that you should allow others to recognize you as? And so, like, what are your thoughts on that?
The context that I have for this is that in one of the martial arts that I study, you are not allowed to call yourself a master. This has to be bestowed on you by your students.
Okay.
Interesting. And it's by your students, not by somebody above you that has greater expertise looking back. That's fascinating. I love that.
Yeah, no, that kind of jives with me. I like that as well. It's interesting, Catherine, as you were saying that, I'm like, am I an expert? Do I consider myself an expert? And I don't conceptualize myself in that way. Like, I don't think that I would say I am an expert anesthesiologist, even though I probably am. Like,
you probably, because I'm like, Catherine, obviously you're an expert in education. Like, Eric, obviously you're an expert in, like, it's easy for me to apply those labels to you, but I'm like, oh yeah, no, I totally am not. So I think maybe that's inherent to it, right? Like, it is an outside thing, and maybe it doesn't matter if we view ourselves in that way. But because it is a label that maybe doesn't have there isn't an exact line and a point. And if you view yourself as an expert, do you stop trying to grow and learn more? And then paradoxically, you're not an expert anymore. Like, so I do think, getting back to my original question, like, does it matter if we can define expertise? I don't know if it matters we can quantify it. I think it does matter if we can define it and we can prioritize it and we can strive for it. But whether or not, like, we all agree on labels and cutoffs, that's where I'm not sure. But I think, like, back to what you were talking about at the beginning, Eric, like, I would like to be able to certify golf instructors, so that if I pick somebody, if I'm going to pay you to help me with I'd like to have some reassurances that you're going to be able to do a good job. So I do understand the very practical reason to try to quantify and identify expertise. And I think that would be super helpful for education, to be able to say, like, yes, I have attained, if not expertise, a certain degree of knowledge and excellence and ability. Maybe you call it expertise, maybe there's levels of expertise, but I do think there is a practical benefit to trying to sort out, like, who has demonstrated the qualities and criteria that we deem appropriate for expertise in education. I mean, we know vet med would benefit from that. I mean, I guess vet med would benefit if people who hired educators cared about such a thing.
Yes.
You do
I
need
do
both pieces of that. It does need to also be valued, but
I do think that that's increasingly happening.
Oh, for
I mean,
sure.
I hope that I'm not, misperceiving this,
It
but
is.
I feel very strongly that we're in a really nice time. It's like there's a lot of people who've been like hitting their heads against the brick wall for a long time, but it's finally starting to move a brick. And I think it's really an exciting time to be, part of the process.
Paradigm shift. We're in the midst of it.
Yeah. Yeah.
I think so.
That's awesome. I think that's a good conclusion for us to wrap
Yeah.
on.
Yeah.
Yeah. Oh, this was really fun. So for those of you listening, we hadn't planned this, and I kind of love that we didn't know we were going to talk about this. So this was all off the cuff for all of us. We didn't even, not like we plan a lot in advance, but usually we know what the topic is going to be. And I didn't, and I actually really dug it. I think it was really fun.
Yeah, I agree. It was a lot of fun.
Awesome. Well, hope you all enjoyed it, and we'll catch you next time.